Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is a term that gets thrown around a lot, and I'm not sure people exactly understand what it means or what the root cause of it is, and that term is radiculopathy. So this is a pretty common problem. Sometimes when you go to the doctor and you're having back pain and you have some symptoms in your feet or your legs or places separate from your back, you may get a diagnosis called radiculopathy, which I've written it out here because it's a confusing word. But what does radiculopathy mean? And especially you might get this diagnosis if you're having numbness or tingling in your feet or increased weakness to your legs, or it could even happen in your neck and you have some symptoms in your hands or your digits. So radiculopathy, what does it mean? To understand what it means, we have to go to the anatomy of the back. I've just Google searched all these pictures and borrowed them from Google just to get an illustration of what I'm talking about. But essentially, you have your spine, which goes from the very, very base of your skull up here. This picture, the girl has a ponytail that's blocking the top, but it goes all the way down through your neck, your trunk, which is called the thoracic region, and your low back, which is the lumbar region that people tend to have the most problems in. And then at the bottom here, there's a bunch of fused vertebra. The vertebra are these different individual elements. There's the sacrum, and then at the very bottom is the coccyx. But most people end up having problems in their low back here when they have radiculopathy. However, it can happen up here in the neck too, and you can have symptoms down your arm, or even a little bit more rare in your trunk area. But essentially what's happened is when you have a radiculopathy, if you can look here at these individual vertebra, these are the different spinal levels. And this spaghetti noodle looking thing coming out the bottoms between these gaps are the nerve roots. And these nerve roots have important information, whether it's sensory information that travels from your skin, from your organs, from your muscles, from different sensory structures in your body and travels up to your brain, or if it's a motor nerve, information traveling either from down from your spinal cord or all the way from your brain down. They come out these little noodle looking things, which are the nerve roots. And it's very important that the space between each vertebra, it has enough space to allow these nerve roots to come out unimpeded. If they get pushed on, depending on where they're getting pushed on, you can have a presentation of symptoms in a certain area, which is helpful to diagnose. Because say you're having throbbing thigh pain, you're having a random mysterious throbbing thigh pain, and it's just aching and you're not sure where it is, and you go to the doctor and they say, oh, you've got an L3 radiculopathy or something like that. Well, you can sort of trace it back to the source of, okay, they're saying I have an L3 radiculopathy. Well, in the lumbar spine, the low back region, there's 5 lumbar vertebra. And if I have an L3 radiculopathy, I know that the 3rd lumbar vertebra must be pushing on a nerve or something, causing those symptoms in my thigh. And I'll give an illustration in a minute here to show you exactly what I'm talking about. But for the sake of understanding what is a radiculopathy, it's essentially just a presentation of symptoms that are resulting from a nerve root compression. And those symptoms are farther away from the source, meaning that you can have your symptoms in your feet, your knees, your legs, or something that's not at your back, but because your back, the nerve is getting pushed on at the back, that information is getting impeded and short-circuited, for lack of a better analogy. So a radiculopathy is essentially, in the very general terms, just a symptomatic presentation of symptoms farther away from the source. And that's kind of what this picture is illustrating here, is that wherever this nerve is getting compressed, the presentation of symptoms is farther down the chain here, because up here at the source is just pushing on this nerve, which then farther down the chain of the nerve path is the presentation of symptoms. Now, I mentioned earlier about physicians and doctors and physical therapists and other people who are medically trained can a little bit isolate the source of the pain based upon the presentation of symptoms. And saying that, because each one of these vertebra has a corresponding nerve root, these nerve roots supply different areas of the body. And we talk about this in something called a dermatome and a myotome map. And essentially what that map is it's a map of the body that has different areas delineated based on where the nerve root travels to and supplies. Let's go to the dermatome map. So this is a funky looking, I don't know, I think of this as like a circus picture, but as you can see, this striped, let me zoom in so you can see it better. This striped anatomical figure has different stripes corresponding with the different levels of vertebra, the different spinal levels. So hopefully you can see the picture here, but like the back of the head is C2, which is the second cervical, the second nerve, the second vertebra in the neck. And then going down the chain, C3, C4, C5, C6, C7, C8 is an interesting one. In the bottom cervical spine, there's a little bit of a split that happens, but we don't need to get into that now. But essentially, this picture to my right over here is, you can see the different levels, and hopefully it's kind of gray and ghosted looking, but hopefully you can see the different spinal levels reflected back from these nerves that are coming out. But these different levels of the spine correspond to these different nerve root patterns. So say you're having some random numbness and tingling in your hands. Well, it could be that, okay, somewhere in your neck or about C7, could be getting compressed or trapped up here, leading to a presentation of symptoms farther down the chain because something is getting short-circuited. Same thing with the leg. So if you remember earlier in this presentation, I talked about, so say you go to the doctor and you've got some random throbbing thigh pain, the front of your thigh. And I said, well, that could be an L3 nerve root compression. You would need a physician to diagnose that for you. But it just so happens that the third lumbar vertebra has this pattern that goes right across the top of your thigh, right here. So that's why I was using that as a reference point of, okay, like if you have an L3 issue, you may have a presentation of symptoms, throbbing, pain, numbness, tingling in that top of your thigh. Same thing for L4, one step down the chain. If you've got an L4 issue, you may have some discomfort in your knee, or you may have weakness to your knee, or some other presentation of symptoms, because L4 corresponds with the nerve root that supplies the front of the knee and some of the lower shin on the inside. But the point of this is just to show that there are different nerve root patterns that supply different areas of the body. And in the term radiculopathy, it could be that the problem is presenting farther, like in the hands or the feet, but the problem could be sourced at the back. Something in the back is getting short-circuited and it's presenting with symptoms just down the nerve pathway. So when we talk about dermatomes specifically refer to primarily the sensory patterns. Sensory patterns meaning pain receptors, pressure receptors, vibration receptors, different information coming from your periphery, your body, or your internal, your guts and all that, and sending signals back through the body to the spinal cord and then to the brain. So the dermatomes, which is this map here, is primarily the sensory pattern. You also, because these nerve roots follow a specific path, you can also talk about the muscle patterns, the motor patterns. You can see, hopefully you can see here in this picture down. Let me move my face here to the other side. So as you can see, there's the particular pattern that we talked about, and these nerve roots supply different muscles and areas of the body. Like when we talked about the top cervical, the top neck region, it supplies some of the muscles of the neck, which are involved in extending and flexing the neck. And lower down, the third cervical vertebra is involved in bending the neck to the side. And then the fourth one, a little bit farther down, is important for shoulder elevation. So my point being here is, if you're having just a random weakness to your legs or your ankles or your thighs, or something that you're having just weird sensation and increased weakness, it may be that somewhere in your spine, in the chain, is getting compressed and leading to a radicular being the root of the word radiculopathy, pattern of symptoms that are affecting not only your sensory organs, but your muscles as well. It doesn't always have to be both, meaning that you don't always have a presentation of the muscles and the sensory. It's common, but it sometimes can be one or the other, depending on where that particular nerve, let's go back to the picture of nerve, where that particular nerve is getting pushed on, can lead to the presentation of symptoms. So hopefully by now you have at least a general, and this is meant to be a very general understanding of the supply chain of these nerves of the body, both to the motor, meaning the muscles, and the sensory organs in your body. And that term radiculopathy, what exactly it entails, it essentially, for lack of a better explanation, is just a nerve or somewhere is getting compressed, leading to symptoms farther down the chain. So you might say, well, what can I do about this? I have this problem, and the doctor says they don't want to do surgery, but you're still having this problem. What can I do about it? So lots of stretching, particularly stretching the muscles in your low back and your hamstrings, which go from your bottom here all the way down to the back of your knee. Things that are going to pull and compress the spine in its normal movement. You want to try to relieve some of that muscular tension, particularly after you've been sleeping for a while and in a static position. Like say you went to the movie theater and you're sitting there, and you're just having you're just having those symptoms, and then you get up, you stretch, you move around, and then you feel better. Um, the point is stretching and moving to try to relieve some of this pressure. Um, what I would recommend for people who have this problem is, especially when they first get up in the morning, try to do some stretching, even just laying down in the bed. Try to move your hips side to side, try to stretch your knees, try to stretch your glutes and your hamstrings and the bottom of your hip. Um, just to allow your spine to go through its normal regular movement without having so much muscular tension and compressive force to these nerves. Um, Important things you can do during the day. If you're able to, stand up, walk around a little bit. Try not to sit for very prolonged periods of time. I mean, sitting for 20, 30 minutes, that's okay. But really just allow yourself to get up, walk around, stretch, move your spine through its normal motion so that it has the ability to relieve some pressure on these nerves. The pool is a great activity because of the natural buoyancy of the water. You don't have a little bit the compressive force of gravity acting through your body is negated, just to allow a little bit of relief to these structures. The pool allows for a little bit more fluid movement of your body and allows for a little bit less pressure to these structures while building strength, building endurance, building heart endurance. The pool is a great activity. Other things you can do are like a seated recumbent activity, like a new step or a seated recumbent bike, just to have those big, large scale movements, but also providing a relief position and adequate support to your back to try to a little bit reduce the pressure of gravity acting through the axis of your body. If As long as you don't have any serious blood pressure issues or an open wound, you can use heat to like a moist hot pack or a heating pad or something that's not going to burn you, but you can apply it locally to the area to try to stretch some of these muscles and relieve some of the tension. And heat also has a calming effect on your nervous system. Um, so I tend to avoid recommending ice for this condition, except for if you do ice very, very locally to the spot that may be inflamed or irritated. So if you're gonna do ice, you probably want like a smaller gel ice pack, something where you can exactly isolate the spot that may be inflamed. And that's being in your back. Positioning can have an effect. If you're sleeping flat on your back or in some position that's putting a lot of mechanical strain on your back and not allowing not allowing these gaps between your spine, but also if you're flat on your back and you're throughout the whole night, your legs are straight. As soon as you get up and move, it's going to put a lot of mechanical tension on the low back, pulling it and pushing on these nerves. So if you're sleeping, try sleeping with a pillow under your knees or some sort of relief position where you're not straight as a board, you're actually a little bit flexed and bent to relieve some pressure to your back and tilt your pelvis a little bit. That's about it. Again, we're talking about radiculopathy, and that's just a general term that you may have heard either in the news or if you've been diagnosed with this. But essentially, in a very general sense, the problem is that somewhere in your back, a nerve is getting pushed or compressed or is short-circuited, and you're not having enough flow of information. So you can have a presentation of symptoms farther down the body in the feet or the legs or the hands or somewhere else other than the back, even though the back is the source of the problem. So again, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.